Hello everyone, and welcome to this overview of this audio podcast overview in as part of some projected investigation, a projected investigation looking at a national study to understand coping in children and young people with chronic kidney disease, CKD, and CKD with other conditions. As part of this overview, a little bit of intro. So CKD is a major public health problem globally, and in the UK, approximately 3.25 million people, 3.25 million people are living with CKD or live with CKD, and particularly in between CKD stages 3 through 5. That is to inform that there are five stages in around CKD. However, 3.25 million people live with CKD stages 3 through 5. For CKD stages 4 and 5 being the more severe, severe forms of CKD in as part of the severity of and in across CKD in and across varying CKD conditions. A further 3.9 million people are estimated to have CKD stages 1 and 2. CKD stages 1 and 2 from a laboratory investigation perspective or pathology perspective are generally where CKD stages are detectable through screening. There is and have been variances in how CKD stages 1 and 2 are firstly reported, and also how varying clinical practice the severity in around the significance of the severity in comparison to CKD stages 3 through 5 from a laboratory perspective. So together reaching a total of 7.2 million, or just over more than 10% of the entire population. And there is some informed data, aspects of data in the National Institute of Clinical Excellence, NICE 2021. The organization, the British Association of Paediatric Nephrology, BAPN, highlights or has highlighted that in the UK, the Renal Registry, UK Renal Registry or UKRR report that in the UK that there are about 8.8 per million population of children or young people less than the age of 16 years of age diagnosed with different forms of kidney disease in 2021. Kidney replacement therapy, or KRT, and often in amongst literature referred to as renal replacement therapy or RRT, incidence in young people is reported as high as 18, just over 18 per million population. The UKRR report also highlights that at the end of 2021, 842 pediatrics or children, young people under the age of 16 years were on different forms of treatment or treatment modalities for varying renal or kidney diseases. In around CKD epidemiology, most patients or recipients were being treated with peritoneal dialysis, which is a form of KRT, being less invasive in around just under 80%, and the highest number of recipients who had received at the same time a live transplant where KRT is concerned, we're in the ages four to just under 8 years of age, under 8 years of age, and being the sort of age bracket. This contrasts with children and young people in the same age bracket, who had received a cadaveric transplant and a cadaveric transplant in around where 18.4%, 18.4%, 48.1% within the 12 to 15 or just under 16-year age bracket had received a live transplant. In around the literature has also sort of explored or investigated different concepts of coping, and a literature review had surmised how children and young people cope with CKD, and from works by Mohammed and team from around 2012. And the literature review uncovered three main themes surrounding coping. Firstly, lack of coping, sort of a definitional basis of in around coping. Secondly, in around coping strategies in young people, and thirdly, in around barriers to understanding of coping, and barriers or hindrances to the understanding of coping in young people. And there is also some evidence to suggest that the rates of acute rejection, for example, in acute rejection in as part of in around solid organ transplantation, tend to be higher also in young people that have more than one condition. And so by implementing, for example, healthcare educational clinics, for example, this can improve young people's lives. At the same time, coping positively empowers young people to take a full part in the management of the kidney condition and other condition more effectively. And together, these must be envisaged as important areas by providers, as healthcare service providers of both pediatrics or children, pediatric children and young people, and adult kidney or renal services. Additionally, through educational clinics, for example, for children and young people, access to knowledge should include in around lab tests and investigations, biopsy and surgery, in around aspects pertaining to in around nutrition, renal replacement therapy or kidney replacement therapy, in around in around aspects pertaining to psychology and related, pharmacy and medicines, lifestyle, wellness and well-being, physical activity, peer support, and in around infections. This can support children and young people in CKD and other conditions, and families with the most important elements of healthcare. The last decade has seen research gather momentum with the development of an objective evidence-based investigating the use of social media and integrating healthcare services for CKD patients and other conditions. In around as part of sort of the projective investigation, the research question would be, how do children or young people with a CKD and CKD with other conditions cope? And the projected work would look to firstly inform of what coping strategies participants adapt, or children and young people adapt. Secondly, to highlight the challenges the young people and particularly in the ages of 10 ages of 10 to 25 have with CKD and other healthcare conditions. Thirdly, how can kidney care services or renal care services for children and young people be made better? And fourthly, to develop a national coping guideline that is linked between, for example, the British Association of Paediatric Nephrology and the Royal College of Paediatrics and Child Health and other and other and other and other important organizations. In around the specific objectives, the using mixed methodology for data collection, using mixed methodology for data collection, this projected works would look to investigate coping and experiences of young people with CKD and other conditions in pediatric and young people kidney care kidney care and renal or kidney services to investigate the challenges young people have with CKD and other conditions, to investigate what further healthcare should be provided to young people with CKD and other illnesses, and to investigate what aptitudes young people require as necessary to become autonomous or independent in managing care or managing healthcare. And as part of the methodology, of projective works, the investigation will look to involve the implementation of mixed methodology, quantitative and qualitative data collection methods or methodology at time points 0, 6, 12, and 18 months to attain an in-depth understanding of coping in children and young people with CKD, in the ages of between 10 and 25, and additionally with CKD, those with CKD and other healthcare conditions, again in the ages of 10 to 25, and young healthy people or young healthy people cohort in the ages of 10 to 25, and parents and guardians collating data at several time points up to 18 to 24 months. In as part of the quantitative arm, all young people would be invited to complete the ways a validated survey referred to as the Ways of Coping survey, or Ways, which was initially a survey that was developed by Folkman and Lazarus in around 1984 at time points 0, 6, and 12 and 18-month time points, and where up to about 100 children, young people would be invited to complete a paper or online version of the validated questionnaire. As part of the qualitative arm, participants would be invited to participate in either one-to-one face-to-face interviews and or telephone interviews or online interviews for up to about 40 minutes, and depending on how many children and young people would be recruited at participating sites. Implementing semi-structured questions or interviews on themes surrounding coping, all participants would be invited to take part at 0, 6, and 12 and 18-month time points to attain perspectives on coping strategies. Now the question is, why is this important? So even more understanding is required from children and young people with CKD and other conditions, because firstly, children and young people live with the actual or threatened loss or impairment of body functioning, such as weakness, a lack of energy, and impaired cognition. Secondly, it can be challenging to understand early kidney disease or kidney disease with other conditions, because healthcare consists of variances across different etiologies and clinical symptoms. Thirdly, children and young people tend to have different clinical backgrounds to adult sufferers of kidney disease or kidney disease and other conditions, and respond differently to treatments or treatment modalities. Fourthly, children and young people have a unique need for play, learning, and education during illness and healthcare. Children and young people may have a lifetime of kidney disease and treatment, making them vulnerable making them susceptible to long-term complications, such as restricted growth, which can affect physical and psychosocial development. And then, additionally, children and young people can have poor prognosis or survival rates, and lived experiences if they are not equipped to cope. I look at now a coping corollary. So in As part of coping corollary, national estimates of prevalence of childhood chronic illness, i.e., prolonged chronic illness or disability that interferes with sort of daily functioning, indicate that approximately about 30% of children and young people under the age of 18 years have one or more chronic illness or condition. However, the recurring symptoms of end stage kidney disease or ESKD being the sort of terminal end of allied to the CKD stages, lead to abnormal sort of challenges, for example, in around hospitalization and/or invasive medical procedures, which result in periodical adjustments for chronically ill young populations. As part of this sort of projected works, I look at an overview, if you like, in around coping and stress sort of models and theories. There have been works going back as far as the late 1920s, where Walter Cannon had developed the fight or flight model and theory, where Walter Cannon had conceptualized the fight or flight model as a sort of a physiological model or theory. Then in around 1936, endocrinologist Hans Selye had developed the physiological a model and theory in around the general adaptation syndrome, and then in around between 1964 to 1969, Moose and Solomon had developed the physiological model or theory, the central nervous system, and immunity. And then in around 1966, in at the same time, between that 1964 and 1969 duration, Richard Lazarus had developed the harm, threat, and challenge theory, a model and theory, which in around 1966, which that had been a theory or model that actually was from a psychological perspective. And then in around 1977, George Engel had developed the biopsychosocial model or theory. The biopsychosocial model was perhaps one of the first sort of models, models and theories in around coping and stress that actually linked or was an attempt to link psychological and physiological sort of aspects pertaining to um, in around coping and stress. And then it was in around 1980 and 1985, but also in 1997, the late noughties, if you like. The investigator Susan Folkman had developed the positive emotions theory, moral theory, which was a psychological model theory. And then there have been sort of published works in around a moral theory that attempts to link psychology, neurology, and immunology together, where the concept is in amongst literature as the psychoneuroimmunology or PNI concept, which looks to interlink psychological and physiological models and theories in around a model theory in around again interlinking in around in around a look at coping and stress. And then there had been a theory referred to as primarily a stress model, and the theory the model of theory is referred in literature as a diathesis stress model, which is a link between psychology in around the psychology and physiology, and there's publications. There's evidence that can be referred to, and in around sort of the scientific value and contribution of the projected works. Young people with CKD and other conditions have several potential challenges, and the main outcome for this one of the main outcomes for the projected works is to see the development of a national coping guideline for children and young people with CKD and other conditions to complement clinical practice or practices. In addition to this, is to see that there is an e-health educational service for children and young people, as for a e-health educational service for children and young people through social media platform, the renal patient support group, whereby both patients and professionals patients and professionals are involved are sort of co-develop and are involved. And then additionally, as part of the scientific value and contribution, a guideline would be projected to be linked between the British Association of Paediatric Nephrology, the Royal College of Paediatrics and Child Health, and Kidney Care UK, alongside the Kidney Disease and Renal Support Group, or KDARS group for kids, and the RPSG. Another question is how will this investigation be of advantage to patients? So fewer children and young people than adults with fewer children, fewer children, fewer young people, children or young people have CKD than adult counterparts, but inevitably the care pathway also leads for them requiring hemodialysis or HD and peritoneal dialysis treatment or a kidney transplant. Acute kidney injury (AKI) survival rates have improved in children and young people population over the years, from 9 out of every 100 in 1999 to 2003 to in around 18 out of every 100 in 2009 to 2013. In addition to CKD, one in three young children or young people have other conditions or diseases or disorders or a disorder, thus making healthcare or care complex. Out of every 100 young people, 75 will have at least one risk factor for conditions or complications. 10 out of every 100 will have at least will have three or more risk factors, and there is a need to prompt the significance of diagnosis and comorbidities in children and young people with CKD. In around the projected outcomes, although as per mentioned in a previous slide, understanding how children and young people cope with different forms of disease should be an integral part of kidney care. And so the plan is to see that this projected works will take place between 18 to 24 months, with a plan to see a development of a national coping guideline for children and young people with CKD and CKD with other conditions. An anticipated co-developed national coping guideline would be integrated, will look to be integrated between the BAPN and the RCPCH, wherein it would offer an evidence-based solution implemented and led by pediatric nephrology or pediatric specialist kidney services for children and young people nationally and potentially internationally. Just to to close on this presentation overview. Some references. So there's publications by Mohammed and team from 2012, Mohammed and team in around 2014, Mohammed and team from around 2016, and Mohammed and team in around works from 2024. In on the most important sort of relatable publications that can be referred to in as part of this overview is works by Mohammed and team from 2016 looking at coping in young people with chronic kidney disease (CKD), published in the Journal of Renal Care, and publication by Mohammed and team in around 2024, Understanding Education for Healthcare Service Users Aligned to Social Media Platforms. That closes this overview. Thank you for listening in.